Ankeet Bhatt, my Gibson coming to you live from HCC 2023, and we're talking about implementation science, particularly when it comes to heart failure with reduced ejection fraction. Talk to us about the Implement Heart Failure study.
We were really interested in strategies to implement therapy for heart failure with reduced ejection fraction. As you know, this has been a pervasive clinical problem. Particularly, we were interested in the hospitalization as a window of opportunity to do so. And so we studied an intervention which utilized a virtual care team that was able to operate across 3 diverse care entities in one healthcare integrated healthcare delivery network, and provided up to 1 care suggestion to treating teams on how to improve guideline-directed medical therapy for patients with heart failure.
And when you say a virtual team, was this an algorithm, or are these actually people just kind of providing the suggestions?
Yeah, thanks. It was a physician and a pharmacist that followed a evidence-based algorithm with modifications based on the patient's conditions, labs, and current state of care.
Cool.
Importantly, we included 2 populations which have been generally excluded from other implementation trials. Those patients admitted with HFrEF, but not for HFrEF, so-called secondary hospitalizations for heart failure, and those in which they developed heart failure during their index encounter.
And what did you find? Did this improve outcomes?
Yeah, so our primary outcome was a GDMT optimization score, which assessed a patient's guideline-directed medical therapy from hospital admission to hospital discharge. We saw an improvement in those allocated to the virtual care team intervention. We also looked at the proportion of patients who had net optimization, who left better off than they did when they came into the hospital. We found a 20% absolute improvement in net intensification amongst patients who were allocated to the virtual care team arm as compared to usual care.
Did you look at any heart outcomes like rehospitalization for heart failure?
Yeah, that's a fantastic question. And this work is underway to now follow these patients after they leave the hospital and understand whether, one, these improvements are durable, either in short, medium, and long-term follow-up, but really on the heels of other studies like strong heart failure, whether these improvements will translate into improved clinical outcomes for these patients.
We've had a lot of great basic science, a lot of great clinical science in the heart failure space, but it hasn't really been matched by the implementation science in getting people on these drugs. Great to see you working on this. Great to see the improvements that were made. Thanks for joining us, and thanks to all of you for joining us here at ACC 2023.
Thanks so much.